This is Sasha the Diva, and
I'm Dr. Heather.
Alright guys, you know health is really important.
Serious stuff.
And a lot of ladies are dying from breast cancer.
Younger ladies and a higher percentage of African American ladies die of triple negative breast cancer. They tend to be more lethal. So
okay, wait a minute. Early. When you say younger ladies, like how old?
Well, we are seeing more dangerous breast cancers that are harder to treat in ladies in their late 20s and early 30s.
Oh my goodness.
Most women in their late 20s and early 30s do not get breast cancer. It's still a small number of ladies in general, but of the ladies who get breast cancer in those age groups, it tends to be harder to treat.
Dr. Heather is a specialist, right? Mm-hmm. Give me your qualifications. You know I want to know.
Yes, well, I went to medical school at Medical College of Georgia in Augusta, Georgia, and I did my surgery training, my surgery residency training at Emory University here in Atlanta.
Okay.
And then have been working at our practice for 9 going on 10 years at Piedmont Hospital, and we are opening up a second office at Northside Hospital, so I've been doing just breast treatment for 9 going on 10 years.
You know women are guilty of this. We do 100,000 things that we don't take care of ourselves. Right. And it's very important to give yourself a breast exam every month, right?
Right, right.
Give us some tips on how to remember to do it. Mm-hmm. And how do we do it? Because I'm really guilty, guys. I have to tell you this. I'm super busy also, and I actually forget.
Right.
And I don't want to forget. I want us to live a long time, all right? So give me some tips.
And a lot of breast cancers are caught by women that are doing breast exams.
Okay.
The important thing to remember is that you don't need to be afraid of your breasts. A lot of people think that they are weapons of mass destruction, and at any moment...
Are you kidding?
Well,
we think that of our breasts?
Well, we probably should do. They're probably that.
Oh, okay.
But in fact, it's not an Easter egg hunt. You don't have to map your breast. You don't have to memorize every lump that's in your breast tissue. And most of the things you're going to feel are, in fact, going to be safe.
But when you feel it, is it something that's like, wow, there it is? Or is it something you really have to feel for?
Most of the time when a woman feels a breast cancer and discovers it herself, most of the time it's something that she's never felt before. It really stands out, and typically it's very hard. It's usually painless unless you go really mashing on it, and then it starts to become sore in time. But more often than not, people find them accidentally. They're playing with their dog, and their dog jumps on them, or they walk into something with holding something, and it pokes into their chest, or they're with their partner and having some fun, or they're trying on a bathing suit, and the lighting is a little bit different, and they notice a shadow or a divot. Wow. Sometimes it's just appreciating that something is a little bit different. So the whole point of a breast exam and doing it regularly is to know what you typically feel like.
So is the best time to give yourself a breast exam is maybe when your period comes on?
After your period is over.
After the period is.
When
Why
your period
is that?
Is over. Hormones tend to die down, and all of the excitement in the tissue and the fluid that's built up in the tissue and has made things sore, lumpy, and uneven, that kind of calms down. The tissue itself can relax, and things that are naturally harder as the tissue is softer will stand out more.
Okay, so listen, we're not in a doctor's office, and we're not going to be in a doctor's office every month when we give the exam. Mm-hmm. So here I am. What am I supposed to do? Show me.
The best thing to do is to feel in 2 directions.
Okay.
You can feel either up and down and side to side, first one breast and then the other, and you want to get as high as your collarbone. You want to get lower than your bra line or your bathing suit line.
Why do we go this high?
Well, the breast tissue actually goes up to your collarbone.
Okay.
So you don't just want to feel the center of your breast. It's not very likely to have a breast cancer this high, but then you know you felt past all of the glandular milk-producing tissue where a cancer can actually be produced or come from.
Okay, so I start here and then as low as here.
Yep, and you can either do it, you have 2 choices. You can either do it like a grid, bottom to top and side to side, just so that you're feeling all of the tissue in 2 different directions.
Okay.
Or what most people do is sort of like a wagon wheel and then like a target or a spiral.
Okay. And then when you push in, how far are you supposed to be pushing in to feel?
There's no wrong way or no right. There's no perfect way, and everybody's breast tissue is a little bit different. Some ladies have very soft, even breast tissue, and the milk-producing tissue, there's more of it in the upper outer breast. And if they push really hard, they're kind of wadding the tissue up into lumps, and they feel lumps that aren't really there.
Okay.
Other ladies have very even tissue, and you don't have to push as hard. You can feel things very easily. Other ladies have thicker tissue. It's a little bit everywhere, and in order to kind of feel it everywhere, they have to put a little bit more pressure. You typically want to feel in the flat part of your fingertips here. You don't really want to use your fingertips, and you don't really want to use your thumb as much. The sensitivity's not as good, so you want to use the flat part of 3 fingers usually. Okay. And as long as you get it in 2 directions, and generally do it kind of the same way. You also want to feel underneath your underarm area.
Okay.
Your lymph nodes. Exactly.
What is a lymph node?
A lymph node is usually a jelly bean-sized organ or a lentil-sized organ or somewhere in between, and it serves as a connection point between a network of vascular channels that exist throughout our entire body that's not our arteries and not our veins. It's another vascular
what I'm loving
network.
about Dr. Heather? I'm actually understanding what she's talking about. Now go ahead, okay? Because I'm sitting up here like, I understand. You know how you go to a doctor's office and you don't have a clue, and then sometimes you're so intimidated you don't want to ask. That's not me.
That's why I wanted to go into medicine.
Yes. Okay.
Yes, exactly.
Now, what about a woman if she has a breast implant? How does she check?
Well, with the implant, most ladies' implants are underneath the glandular tissue or underneath the muscle. So either way, all of the important tissue that could contain a cancer should be shoved forward. So the pattern is going to be the same way, just in 2 different directions, feeling around. When a woman has an implant and has a mammogram, a little bit different things happen. First thing is that a woman with an implant has to have 4 pictures taken instead of 2. A woman who doesn't have implants just has a picture from the bottom to the top and a picture from side to side. And with an implant, we take the top to bottom and side to sides, but we do it with the implant in place, and then we kind of pull the tissue out and just do it of the tissue alone. So you have to have extra pictures.
Look, we want you to live a long time. And if you catch this early, your chances are great that you will survive and not have breast cancer. Right?
Most people who are diagnosed with breast cancer, even the ones that are more aggressive, even if you're a younger patient, even if you have characteristics that are showing that the cancer is not as treatable, maybe there are fewer medicines that could be used to treat it, there's still huge amounts of hope, huge amounts of success, lots of survivors.
You've got to tell me about Angela Jolie and what she did.
Right.
What do you think about that?
I think that was a very brave and wonderful thing for her to share her experience. Her experience and her situation does not apply to everyone.
Right.
But for the people that it does apply to, I think that she probably will save some lives. I absolutely do. Wow. Her specific situation was her mother had ovarian cancer, and there was a concern that there was a gene. I'm not sure exactly because I don't know anything about her treatment or her personal health, but she was tested and apparently found to have a variation of the gene that makes it easier for breast cancers to happen and ovarian cancers to happen as well. So she has chosen to have her breast tissue removed, but preserve the skin, preserve the nipple, and have it filled back up with artificial material and implant.
And that'll come in later when she's able to do that.
No, it's usually done all at once. Yes.
You're kidding me.
I know. We do beautiful things nowadays.
Wow.
Really amazing things.
Dr. Heather. So,
not to be afraid. Don't need to be afraid of it. How to learn about it.
That's tip number 1, right?
Don't be afraid.
Okay.
And if you do find something that worries you or scares you or feels different or stands out to you, to your fingertips or to your mind, then bring it to your doctor's attention. We love to tell healthy people they're still healthy and they're just fine.
Oh, that's sweet. Tip number 2 would be what?
Tip number 2 would be don't punish yourself or worry if you do lots of exams or if you miss an exam, if you miss one a month. That's okay. The whole point of doing a breast exam is just to appreciate what your tissue normally feels like. So if something changes, you can say, "Hey, I've never felt that before. This area stands out." Or, "Wait a second, I felt rubbery lumps before, but this one's totally different. This is hard, and this hasn't changed in 2 months, and it really doesn't hurt. But my fingertips go right to it, and it really jumps out to my touch." Or, "Hey, wow, my nipple's pulling in," or "There's a shadow," or "Something's really different here." And it's hard to appreciate that something's different if you don't know what normal is.
And ladies, I know that I'm talking to you, but we're talking to the fellas also because men get breast cancer also. Right. So if you feel anything, you have any questions, then call Dr. Heather. What's your number, Dr. Heather?
Well, we can be found on the website. We're Atlanta Breast Care.
Okay.
And we're happy to answer questions and take care of anybody who has a concern or is worried about something. We'll help them figure it out.
Okay, guys, I have to go because I have to go check. I have to give myself an exam right now, okay? Later. Thank you, Dr. Heather.
You're going to do great.
Bless you.